So ethnic inequalities in healthcare have revealed vast inequalities across a range of health services. Joining us this morning to discuss healthcare inequity is founder and managing director for Shine Aloud UK, Rianna Raymond-Williams. Good morning, Rianna. Welcome to Smile Jamaica. How are you?
Good morning. I'm well, thank you. How are you doing?
Oh, we are great. You're speaking with Delia and Neville. First, tell me about Shine Aloud UK. Let's start there. What's that?
So Shine Aloud is a community organisation that I started when I was around 18. It aims to address sexual health inequalities. We started with a sexual health publication because my background is in journalism. So we created a resource to educate young people about sex and relationships. Since the magazine, we've gone on to do training internationally in Europe, educating young people not just about sex and relationships, but health and health awareness, essentially.
Yeah. When you say health inequity in minority communities, I can understand what that phrase means, but tell me what you're talking about.
So health inequalities compound the experiences of minority communities. For example, poor education, poor healthcare, poor and unhealthy living environments, all of that create complex conditions for people to live and exist in. So essentially, the unequal distribution of resources make people and communities more vulnerable and less able to have agency over their lives.
Okay, so let's pin down some of those inequities. Is some of it access to healthcare, and at what level is access a challenge?
So I guess in the UK where I'm from, sometimes people can access adequate healthcare and they may access information that's adequate as well. But even when they access healthcare and information, they may still experience discrimination. So we have the issue of racism, which is a very big issue in the UK, which impacts the ability for people to maintain relationships with health systems.
Oh, that's an interesting. I never, I never pinned that as an issue. Is it that in the minority communities as well, because you're saying there's access, but is the standard of healthcare the same?
I would say, I guess there's perceptions made about people's bodies.
Right.
So me being a Black woman, there could be perceptions made about my body that make it kind of difficult for me to access the care that I need. People may feel like I'm argumentative. People may feel that I'm being too assertive if I go in and I request a particular thing. And that's because there's perceptions about me being a Black woman, which are linked to historical stereotypes that aren't correct. But we still have a long way to go to kind of challenge and address these issues of discrimination that exist in the healthcare system.
Right.
I'm reading here, and it says some of the largest inequalities were found in mental health care. That is so? That is so in the United Kingdom?
Absolutely. And I think we're recognizing it now more than ever before, particularly when we think about COVID and the impact it has had on communities. Communities want to access care because they're struggling with particular health challenges, but because of how they're treated when they access care, they become resistant and reluctant to engage in that care. So yeah, I think there needs to be more solutions devised with communities in mind that speak directly to the issues that people experience, and they can co-design and create solutions for them to have better health long term.
Yeah. We are a third world country, and we get so many requests here for people needing money to do operations for different reasons, and they can't find the money. Is that because we're a poor country, or is that because we, as some people might think, we're a Black country?
I think it definitely goes down to distribution of resources. Unfortunately, Jamaica is less resourced. I wouldn't say that the UK or America, there's an assumption that it's better care. I think it's different care because of the resources that we have. But there's a lot we can learn from our colleagues across the pond, in Caribbean islands, in African countries, to kind of get a sense of what it means to deliver care in a majority Black country.
Yeah. What I just got, and you'll correct me if I'm wrong, is that maybe we are as good as anywhere else in the world. We just don't have the money to show that we're good as anywhere else in the world, right?
Absolutely. Under-resourced, undervalued. And I think something that I found out, which was quite shocking for me, I've been doing a lot of observation this week, working with the University of West Indies, and I've had the chance to kind of speak to colleagues in the faculty, and I had a chance to go into their labs. And I saw that in their labs where predominantly Black students are training to become medical professionals, all of the dummies in which they're training on are white male mannequins. So if you can only imagine that if your training is only delivered on one particular type of body, you then create a precedence about who is deserving of care and who needs care. So I think we've got a long way to go when we think about in the very small area of training, if you're only training on one particular body, how that creates inequalities long term.
Yeah, I don't want to hog the interview, but I have another question before Delia. But healthcare is expensive, whether you agree with that or not. It is expensive. So how do we fix it? In other words, if I get sick and I just don't have the money to help myself, what am I going to do?
Yeah, I don't agree with that. I think healthcare should be free because we all need health at any part we all need healthcare at any point in our life. And as you rightly said, it shouldn't be a circumstance that because you don't have money or because you don't have the transport to get you to a facility, you may effectively die or experience long-term health conditions. So yeah, I think we need to really change our thinking around health and recognize it as a human right, and really challenge and, work with communities to understand the conditions that they're facing as to why they are so vulnerable.
Yeah. What's the fix, Rianna? Because the challenge with things like systemic racism is it's such a part of how people engage and how things are structured that people are a part of it without sometimes even realizing that this is what you're being a part of. How do we fix this in the health system? Do we lobby for policies to be changed? Who fixes this?
So I think we all play an instrumental part in fixing the problem of racism. I think the first kind of part of that journey is recognizing racism is real and alive and affects people every single day. Mm-hmm. I think it also requires us to invest in research and intervention. So my role is a PhD researcher, and I'm exploring how Black Caribbean women in the UK experience sexual and reproductive healthcare services. And a big part of that research is speaking directly to Black Caribbean women about their experiences. We can only know what people are experiencing and navigating when we speak to them. And I think a lot of time assumptions are made about people as to why they don't engage with healthcare systems in comparison to speaking to them directly to understand what they're dealing with. So I think, investing in research, going directly to people, co-designing interventions with people, so involving communities in the kind of design of how services are delivered is really important to addressing the issues that we currently see today across the board.
Yeah, and part of what we're doing now in terms of raising awareness is also important because you said it, a lot of people don't access the healthcare because they don't want to have to face the racism and they don't want to have to face the negative experience. And so I think part of what you're doing, correct me if I'm wrong, is to raise awareness among the community to say, no, this is your right. And don't allow them to stop you from accessing a healthcare.
Absolutely. And I think for a lot of people, research is inaccessible. You kind of have to go through the educational route. You have to have a first degree, a second degree, and kind of you have to be academically literate in that way. And I think we need to really challenge the way that we provide access to this space so people can come on board and be a part of solution instead of being blamed for the problem that they didn't create.
Yeah. Who pays for healthcare? Governments?
Governments, it should be free for everyone.
Oh, that's a lot of money, though. You're asking. No, I'm not disagreeing with you, but I know somebody said, that's a lot of money because if you look at the hospitals right across the world, they're full every day for whatever reason, unfortunately. Yeah. And you're saying government should foot the bill.
Absolutely. I think about how technology has really shaped or played a role in UK. So I guess the typical health services is one that you go and access in person, but they're now using technology to provide care for people. It could be in a hotel room, such as myself now. It could be from the veranda. But essentially, you log onto a computer screen and you have a conversation with a doctor or nurse, and they assess your condition that you have. And then depending on what treatment you need, they could provide treatment to you in the virtual consultation, or they may call you to come into a clinic physically. But there's so many ways in which we can make healthcare more accessible and also reduce costs. I guess costs are about the building spaces and the resources that's needed to deliver care. But if we can really diversify the way in which we deliver care, it can become more accessible.
All right, we have to go, Rianna. Thank you so much for the work that you're doing. It's very important work. And we look forward to more of your findings as you continue
Thank
to
you very
navigate
much.
this.
And have fun while you're here.
Absolutely. Thank you so much.
Yeah, man. Blessings. God bless you and your family. Look after yourself.
Take care. Thanks.
Yeah.
Founder and Managing Director for Shine Aloud UK, Rianna Raymond-Williams. That's 10 Minutes to Your Health. We'll do it again next Thursday.
All right, coming up next, textile stories. That's interesting. Soon come. Stay with us, please.